The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Sierra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. I am back with MJ Saunders of See My Baby Live because we talked diagnostic ultrasound last time, but we got too excited about wanting to share elective ultrasound. Not everybody gets these. Not everybody does the for funsies ultrasound, as I like to call them, but we want you to know what's available if you do want to do some of these extra ones. So thank you so much, MJ, for being back with me.
Hi, thanks for having me. I love that you call them funsies.
Yeah, for funsies, because that's, lots of things in life are for funsies. So what are some of these, school us on what are some of these for funsie or elective ultrasounds that people get, and when do you get these ones?
Okay. I actually get a decent amount of first trimester, brand new pregnant ultrasound requests. And that's a first peek on my website. Typically that's from 6 to 13 weeks. And these, a lot of times, are people who are at the very beginning. They can't get in with their doctor until 8 to 10 weeks. They're kind of losing their minds because they just are like, what is happening? Am I really pregnant?
See in there.
Yes, I need to see. And I will say, a lot of times those are transvaginal ultrasounds, and I'm going to bring out my probe because
go back to YouTube, guys. If you didn't get to see it on the last episode, come take that top off of that, MJ. There we go. That's what it really is, guys. She makes it look real scary.
So camera is right here. There's a sheath that goes over it. We follow strict sanitation, so everybody is okay. But it goes in only about like that. It's about the length of a tampon. Doesn't hurt you or the baby. But when baby is teeny, and when we say teeny, we mean teeny, teeny, tiny. I made these. This is so funny. I have this little sheet. I don't know if you can see that.
Yeah, I can.
So the top is inches. The bottom is centimeters. So United States, we don't play with our metric system very well. It's hard for us to visualize. But medical, we do a lot of centimeters, millimeters, because they're so very small. That baby is like at 6 weeks, like 0.3 centimeters. That is that's like between these two lines. I know, it's like the tip. It's like the tip of a pen without the pen being popped out. That's a baby we can see a heartbeat on.
Wow.
So sometimes mamas just need to make sure everything is okay. Their husbands too. Like there is a bit of a disconnect, I think, sometimes when the husband's like, I don't know what's going on. She's acting crazy,
I have a little saying in my I teach hypnobirthing classes, and I have a saying, we talk about like bonding in utero. Mm-hmm. And this is absolutely a stereotype, and not everybody feels this way. Not all people who get pregnant feel connected right away, and not all partners feel disconnected. But there's an old saying that a mother becomes a mother the moment she becomes pregnant, and a father becomes a father the moment the baby is born, which again, not all are mothers and fathers, and not all feel that way. But stereotypically, it's, whatever. So agree. A lot of times partners need that look or like that confirmation before they really feel like, okay, there is something in there. Like her body looks totally the same. I don't, all she does is feels a little nauseous. Like, how do we know she didn't just eat something bad,
Yeah. Or they're tired. I will say first trimester moms are exhausted. They're cooking a baby. They haven't done this before. So whether whether it's going to be someone coming to me diagnostic or elective, and we're touching more on electives, I get as early as 6 weeks, sometimes even earlier if they're unsure of their dates.
Can you earlier, like, is it possible that you wouldn't be able to see and then they get nervous, even more nervous?
They do. Sometimes people just have really erratic periods, so they don't know when they ovulated or if they're not sure when their ovulation is. Things we can look for as early as 4 weeks is a gestational sac. So the process in the beginning, we should see a thickened endometrium. Then we should see a little black hole, which is the gestational sac. We should see a round circle, which looks like a donut, and that's the yolk sac. And then we usually see a little bright area, and that's the crown rump length. And then we see the bright area with the flash on it. And that's the heartbeat. In that process, like five weeks on, is we usually start to see that process. And then 9 to 13 weeks is when that umbilical connection is made and everything changes again in there. The yolk sac gets kind of pushed away. The baby is now growing. The baby is feeding off of the umbilical cord to the placenta with the mom. Any time in that range, I'll get people coming in for that first peak. Sometimes they've had bleeding, and they're just a little concerned, or spotting, or cramping. Cramping in a first trimester is really common. It's a steel trap. It's never been opened before.
Yeah.
Yeah. And so there's a lot of cramping during that time. And it can be a little off-putting and concerning. And if they can't always get into their doctor, if their OB is less available, or even their midwife might say, just go see MJ and just, feel better. And they can do those as an elective. And then 14 to 24 weeks, we call that our gender reveal. We can typically see gender at 14 weeks and on. If for some reason we can't see it, we'll probably have you come back in a week. But it's usually we can see it. I mean, we're majority of the time we can. And to put things in perspective of what you should expect to see in the very beginning, it's just kind of a blob that has a heartbeat.
Yeah.
It's a proliferation of cells, but it's literally kind of a blob. By about 9 weeks, the blob starts to take shape with the head and the body and kind of get the gummy arms and the gummy legs. By like 13, 14 weeks, then you start to get the length of the legs. They're kicking around, the arms. You can often see bones in the hand, toesies, the shape of the nose, the mouth, the eye sockets. And then from then on, you get a real baby appearance. Our 3D pictures, which I usually coach to be 27 to 32 weeks, drink lots of fluid before then, because that's how we get our best pictures. That's when you start to get the chubby baby, those beautiful pictures. But that's a variable too. It's dependent upon where your placenta is located. If you have an anterior placenta, which is in the front, that may affect pictures a little bit. If your fluid is low, that may affect pictures. If baby just doesn't get in the right position, that may affect, we get you up, we get you dancing, shaking. Oh my
gosh, that was me. I went to do it with my daughter, and I went to a place kind of out in Round Rock area or something. And I remember I was like, 24. I could get in any position you want me to get in. I'm like, do you need me to do these crazy poses? Like, do I need to go upside down? Like, I was going to do anything. And I had an anterior placenta. I was like, I'll do whatever. And you only have a certain amount of time in there, and they have more appointments. And she's like, you know what? Go over to Round Rock Donuts, get an orange juice and a donut. Like, don't threaten me with a good time, and come back after you eat. And because maybe they'll be a little sugared up and like bounce around a little bit more, and maybe we can get a better picture. But she was just cuddling with my placenta all the time. She just, like, her face was right up against it, like it was her little pillow. And she just did not want us to get those pictures.
They'll like be licking their placenta sometimes. And people say, oh, they're sucking their thumb. Like if the kiddo is got, but anything that's around their mouth, their hands, their feet, their toes, their knees, their umbilical cord, it stimulates them. And they're constantly rooting around in there, trying to find something to lick, to suck on.
They're practicing for when they need to nurse.
They are. And they're just little bugs in there. So we definitely do the best we can. We can usually get something. But those beautiful pictures, I would say probably happen 25% of the time. It's hit or miss.
Okay. And tell me again, what's the range that you suggest for those? Was it 27 to 32? Is that what you said?
Yeah, 27 to 32.
Okay.
Now, I've had good on either side, always exceptions, right? These are individuals, these are little beings. But that's when they start to get chubby enough that you get those nice rounded pictures.
Yeah, I always said my son looked like a snapping turtle in there. Like he looked so, so bony, and he was he ended up being kind of a skinny baby. My daughter had like the big, beautiful cheeks and, you could see her form, but I was like, I think I'm giving birth to a snapping turtle. I'm pretty sure that's what's in there.
I always call the 20-week babies Skeletors because they look like little Skeletors. And people have an idea that it's going to be this beautiful baby picture, but they're bony. They're little skeletons in there. They're really skin and bones, and that's normal. They just haven't chonked up yet. And it's probably good they haven't chonked up yet,
Right.
All in good time.
Remember that if your baby's too big, and then they'll tell you want an induction. So it's okay that they're skeletal.
Yeah, exactly. One of the other things that we offer, and I know some people say, oh, they're not very accurate. We do have the sneak peek DNA. So as early as 6 weeks, we can do a blood draw. We send it off. We get the results back. Typically, depending on what you choose, a day or 2 days. I haven't had them be wrong. Now, again, exceptions to always, to everything. But they're pretty accurate. If you can't wait, and I'm kind of a not waiter type of person, I can relate. Yeah, I got a plan. I have
the moment I could send that thing off, I sent it off.
Yeah. So we have those in office. You can buy them online, but then you also have to pay like a shipping. So the price ends up being the same. But if you come into my studio, you also get to see your baby because I do a quick ultrasound to guarantee you're far enough along. Yeah. So it's kind of nice. And you get pictures. Yeah.
Yeah, that's pretty cool. So for all of you wanting all of the fun stuff and like to do the extra stuff, then you can that's what you can do. Okay, you said 3D, right? That was the one we just talked about. Okay, so there's like more Ds.
There are so many Ds.
All right.
So I have Samsung machines. I want to touch on frequency first.
Okay.
The 3D, 4D, 5D that I'm going to talk about, those are the same frequencies as a curvy. It's just how the machine processes it. I think some people feel that because the pictures look differently, it's more exposure to the baby. It's actually the same technology. It's just how the machine processes it. Now, if you want me to tell you how that happens, I'm not your person.
It's like having better lenses or something, probably. Kind of like Correct. You can have different lenses on the same camera and you're going to get a better picture with some.
Yes. Like when you choose sepia or you choose clarity, different things like that. That's
like a filter, like a filter on Instagram.
It is. It's not a higher frequency. It's the same frequency. So 3D is the stills and they look golden. They're very beautiful. 4D is the golden babies live. So they're moving and grooving in there and they're doing their thing, right? 5D on my machine, some people also call it HD, high def, is flesh colored. And I didn't think about it, but I wish I had examples to show you.
If you give me some, I can put them up on the social media, on the Instagram.
Oh, yeah, I will. I'll send them to you. In my clinic, we use those interchangeably. Some babies look better on 3D. Some babies look better on 5D, which is the flesh colored. It just kind of depends on the baby and how they're laying, where that placenta is. It also depends on the mom and dad and how they see it. So I've been sitting in a room and when I hear ooh, that's the one I want to stay on. Even if I may like it a different way, I got to give some, because whoever said the ooh, that's how they see it best.
That's awesome. Yeah,
it's same with like fonts, right? When we change fonts in writing, it's the same type of idea. But there's no more frequency on one than the other. Some machines you're going to get clearer picture. My machines are 2 years old. They do great pictures. But I want to reassure people, if that's what you want, then that's what you should get. And don't feel bad about it. Make it fun. Bring your friends and family. And enjoy it. We're able to provide a QR code when you're here in clinic, and you can download all those pictures and videos to your phone. It's pretty amazing. And I print out pictures for you as well.
That's awesome. I love that. I like the information about the 4D, 5D, 3D, all of that, because you're right. Our instinct is to think that is quote unquote like worse for you because it's a better picture. Like that's kind of how the world is, right? When something's better, it's got to be worse for you.
Yeah.
So that is good to know that it's kind of funny because you're like, it really doesn't make a difference which one. It's really just a preference, kind of like some people prefer gold jewelry and some people like silver jewelry or whatever.
You know what? You kind of hit the nail on the head, and we can filter stuff out. We can clean up the picture a bunch. Pretty good at that because you need it, especially you get a placenta that's hanging out on a left eyebrow. You need to make that go away. So then you have cutie pie in there. It's kind of amazing technology that I always feel bad when people are like, I know I'm not supposed to be doing this. And I'm like, oh my gosh, mama, just enjoy it. Enjoy your baby. It's totally, be excited. This is your
like
baby.
We're cheating or something.
Biggest,
like you're the parent. You get to decide. Welcome to parenthood.
Yeah.
This is your baby.
And I know people want to do the right thing by their baby. I get it.
Yeah.
I respect it. Me too. But don't be afraid to enjoy it. It's the most amazing event in the world.
Yeah. It just also, like we said before, the connection thing. Some people really need that because also there are people that deal with mental health issues and all sorts of things that may give them anxiety or fear or sadness or whatever about any part of this process. So anything we can do to feel more connected and at peace with the situation, your baby's actually going to, here I'm bringing out some hypnobirthing stuff, but it's like what I do. Anything that's going to make you feel good is going to be better than you sitting in anxiety and fear or frustration or whatever. So I always say our babies marinate in our emotions because our hormones are passing to our babies. So if we can do something that brings us joy, like don't fight it. Don't feel bad or apologize for it. You're not harming your baby. It's not like you're going, I'm going to go smoke cigarettes every day because that's what makes me feel better. Like this is a safe, actually safe thing that you can be doing. And so on these little ones, like the 3D, 4D, that kind of thing, you talked in the diagnostic episode about how long your baby is getting those ultrasound waves. How long on these ones do they usually take?
I don't normally scan for more than 20, 25 minutes max. My arm will fall off if I do too much after a while. But every time that picture is frozen and we're kind of fine tuning it, the baby's not getting exposure. So you kind of have to take off. For the electives, we're typically scanning a little bit longer overall time wise because we're looking for cute pictures. But they're typically about 20, 25 minutes max with pauses in between. And there's never been a study that's done by medicine for OB purposes in a controlled environment by a tech who knows what they're doing to cause side effects. When you go to some of the places that don't have a registered tech, they're going to play with that picture. They're going to increase that frequency. They're going to do stuff that possibly they shouldn't, which could cause additional exposure to your baby. They're going to also scan forever. Some of these places scan for 45 minutes to an hour, easily nonstop, and still not get great pictures. So that's the risk you run when you go to some of the places.
So how can you? That's a good question. How can you make sure that you're going to a legitimate place? What would we be looking for?
If they say registered tech, they should be touting that our technologists are registered, or call them or send an inquiry. They can still get good pictures. And there's some places in town that they give great pictures. But I can tell you, I feel very strongly about my education, my hardcore education, and then my 13 years of experience that I know how to handle a situation. I know if I'm scanning an elective and I see something that's abnormal, because sometimes, they can't identify that because they're not familiar with it. I've made calls behind the scenes to to doctors' offices to say, hey, I think you need to see this person sooner. Because if they saw them at a dating at like 6-7 weeks and it was like a nugget, a little bean baby, you can't really identify much on little bean baby, right? Bean baby is like 0.6 centimeters, and they're not going to see that baby until the anatomy at 20 weeks. And I see something when they come in at 14 weeks. I sure want to give them a heads up to say, I think you should see this patient sooner. Or I think so there's a concern.
That's like a whole like script flipped, we had a little, I hadn't even considered that, that you could accidentally come across something in an elective ultrasound that you actually could end up helping to know earlier. That's really, and having somebody who's registered and understands what they're doing in that situation would be really important. And also, if you're somebody who does want to get a bunch of these elective ones, going to somebody who really knows what they're doing is going to be important, because you don't want to accidentally expose yourself to people turning up those frequencies. Like you said, that is what would make it dangerous. So making sure that you're going to somebody who is really skilled and qualified to do this is, kind of seems like a no-brainer.
Thanks for that. Yes.
Oh yeah. I mean, come on. Yeah, absolutely.
I know.
Okay. So are there any...
Go ahead.
No, I'm the host.
I was just going to say it's a fine line. It's a fine line of, I support people going to get that additional imaging, but maybe because of what I know and the experiences I've had, I always encourage it to be a registered tech. And besides my own place, there's places out there you can go to. When we're scanning, I know this seems kind of funny, maybe not funny, I don't know. You
don't have to qualify it. Go for it.
Yeah. We're looking at so much when we're like looking at the face, or like I'm looking at a 14-week pregnancy and I'm looking at a lot of things. Even though we're after cutie pie pictures, I'm still kind of watching.
You can't turn that off.
No, you can't. And I would hate to have somebody who maybe thinks there's a problem, who isn't, doesn't have as much OB experience or doesn't have a registry, think there's a problem and then set off alarm bells. Or the opposite, somebody who knows that there's a problem and doesn't know how to follow up. I just start making calls. Whatever needs to be done, I'll just start making calls.
Well, I have, we have listeners all over. So we're not all just in Austin. So like she was saying, if you're in Austin, you can absolutely go see her at See My Baby Live. But in your area, if you're looking up and you want to find somewhere to do this sort of thing, you can look this type of work up, but just make sure that you're finding somebody who is registered and that they're touting that, their people have the credentials behind them. So we talked about all of these different scans so far. Were there any that we missed that are fun elective scans? Or did we get them all?
For me and my place, that's kind of covers it. I pretty much have the 3. I do have a VIP package on my website, and those for people I've already seen, we've already gotten established. It's a quick hit. It's like set up to be a 10-minute scan, just reassure, get a couple pictures. Okay, there's my baby. All right, I'm good. And that I actually have a decent amount of people take advantage of. They know, they're like, I'm just going to do this quick one. We're just going to be okay. And then I can sleep tonight.
It's called the Peace of Mind. And no, I don't know what it's actually called. I'm making it up on her website. It's called the Peace of Mind. I
call it Peace of Mind. I do. It's a VIP. It's a Peace of Mind. Yeah.
Does it say that on your website?
Term all the time.
Stop it. I did not look. I was goofing.
I think it says VIP. And then in the description, it says Peace of Mind. So you kind of nailed it. But that's what it's there for. Yeah. It's just a quick hit. And that's really excellent too for people who are really still worried about exposure, or, they just want to keep it on the down low, or they want to keep low interference, whatever, however you want to call it. That's an easy way for them to make sure everything is okay.
Well, next time you go to her website, she's going to have it say for funsies.
I love the funsies. And I will say, when you look up other places, if they have registered techs, I promise you, they're going to be talking about it on their website. Because people who are registered, we had to go through. Yeah, 2 to 4 years of schooling. We had to have, I don't even know how many hundreds of hours. It could even be thousands of hours. We had to have at a clinical site. We have to take registries, which are like 150 plus questions on a test. They basically strip search you before you go in to take the test. If anybody's ever taken a test like that, they don't really. I mean, you keep your clothes on, but
it was
it's kind of a
visual hilarity.
Yeah, everybody's naked taking their test. But you have to have it done in a certain amount of time, and those tests are regulated by the industry. For ultrasound, we take them in whatever our topic is. So I have mine in OBGYN, abdomen, vascular, and echocardiogram. I don't image hearts anymore, but I did for a while. But every time you perfect a skill or a part of the body, then you take a registry to reflect that. And if somebody has done that and they have a business like my own, they're going to talk about it on their website. They're going to want you to know it.
Awesome. Well, thank you so much, MJ. This is so fun. I love that we got to talk about diagnostic ones with you and like the things that most people are doing, but then, letting people know that it can be a little bit fun sometimes. And there are some elective options out there if you're someone that wants to take advantage of those. So be sure to check out MJ on her social media. She posts a lot of great stuff. And if you want to connect with her, all of the information is in the show notes. And there's a special for listeners. If you use code podcast in all caps on her website, you get 25% off for a period of time. That's not going to be forever. So this is a really old episode when you're listening. Maybe it won't work, but at least for the next couple of months. All right. So thank you so much, MJ, for being here. I loved chatting with you.
Thank you for having me.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.